Is your penile discharge normal? Just as ladies have vaginal discharge, so as men do have penis discharge. Hello everyone and welcome to my channel. I'm Gwendolyn Halley, a seasoned and certified medical microbiologist, and I'm popularly known as the medical professional with the difference because I bring you knowledge on health and medicals and a lot more. Stay tuned. Welcome back. If you're just joining us in today's class, please don't forget to like, to subscribe, and join the family, of course. And if you're a returning subscriber, I want to say thank you. My love and kisses to you. Thank you for encouraging me, for your comments, and may God bless you and increase you. Now let's jump back into today's class. Today's class will be talking about, is your penile discharge or penis discharge normal? Just like women have abnormal vaginal discharges, so as men do have abnormal penis discharges. And the two normal discharges a man is supposed to have are the pre-cum, that is the pre-ejaculate, and the cum, that is also called the ejaculate. Now, these normal discharges are very common or occur during arousal or sexual activity. Now, we'll take a look at some of the abnormal types of discharges, a man has, or some of the things or conditions or diseases that may cause a man to have an abnormal discharge. First on our list is urethritis. Urethritis is the inflammation of the urethra. The urethra is the opening or the passage or the tube through which urine comes out through a man's penis. And when a man has urethritis, he experiences or he discharges a yellow or a green discharge. He has pain or he's uncomfortable while urinating, or he has a burning sensation while he's urinating, and he experiences frequent urination. And this is normally caused by sexually transmitted diseases. For example, the herpes simplex virus, gonorrhea, and chlamydia. The next on our list is balanitis. Balanitis is the inflammation of the gland. That means the head of a man's penis. Balanitis is very common in uncircumcised men. That means men who haven't taken out their foreskin, or men who still have their foreskin intact. And it's normally due to allergies, maybe caused by lotions, condoms, soaps, and poor hygiene. Now, when a man has balanitis, he experiences this oozing discharge from the head of his penis. He experiences tightness of the foreskin. His foreskin becomes extremely tight and cannot pull back. He experiences irritations on his penis, rashes on his penis, and also most times difficulty passing out urine. Urinary tract infection. Urinary tract infection is very common in both men and women, and this is normally when feces, that means feces from the anus, finds its way into the urethra. And this is very common in women than men, but when a man has urinary tract infection, it's really disturbing. And the bacteria that is found in the feces now begin to affect the man's reproductive system. When a man has urinary tract infections, he's going to experience a cloudy and foul smell urine, and also a clear and purse-like discharge and pain while urinating. Another problem or condition or issue that may cause a man to have an abnormal discharge is injury on the genitals. When there is an injury on the genitals, the man will experience an abnormal discharge. We also have prostatitis, that is the inflammation of the prostate. Now, in this case, men will experience pain while urinating, difficulty and pain while ejaculating, blood in urine, and actually a foul smelly urine. So these are things you should actually watch out for. Another cause of penile discharge or abnormal penile discharge in a man will be sexually transmitted diseases. And we are talking about especially chlamydia and gonorrhea. With chlamydia, the man will experience pain while urinating and swollen testicles. He will have a watery or mucus-like discharge. For gonorrhea, the man will experience a white or yellow or greenish discharge and swollen testicles and difficulty or pain while urinating. And the last on our list that may cause a man to have an abnormal discharge is if his urethra is damaged. Take for example, if the doctor is actually using a catheter to pass through the man's urethra, and let me say the urethra is damaged, the man is going to experience an abnormal discharge. When I'm talking about abnormal discharges here, I'm talking about discharges that don't occur with sexual activity or arousal. That means that if you're not aroused or you are not having sex, these are the discharges that you will experience during that time. Now let's look at the treatment. How can we treat or solve the issue of this abnormal penis discharge? Now, that will depend on the cause. And in this case, if it's caused by microorganisms, let me say bacteria, fungi, you have to go see your doctor. Maybe antifungal drugs will be prescribed for you or antibacterial drugs will be prescribed for you. If it's in the case of sexually transmitted diseases or urinary tract infections, etc., etc., you will need to see your doctor. And also good hygiene. And we are talking here in the case of balanitis. You will need to pull back your foreskin and clean that area properly. Now, what should you watch out for? You should watch out for your discharge when you are not involved in any sexual activity. You should watch out if you have a burning sensation or pain while urinating. You should watch out how frequent you urinate. You should watch out if there's an inflammation on your testes, or you should watch out if your penis is swollen or irritated or red in color. Now, how can we prevent these abnormal penile discharges? Point number one, make sure you have protected sex. No unprotected sex. This will prevent you from having sexually transmitted disease. And I'm talking about particularly using a condom, because condoms are the number one when it comes to preventing against sexually transmitted diseases, especially if you don't have one sex partner. The next is make sure you have a good hygiene. You clean yourself properly. If you're uncircumcised, you pull your foreskin backwards and wash that area real well. And the third point is have regular checks at your urologist. Go to a urologist. Most times the GP may not really give you the information you need. A urologist is a medical professional specialized in men's sexual health or reproductive health. So this is what you actually need to be able to be healthy sexually. Thank you for joining me in today's class. And I remained your seasoned and certified medical professional, Gwendolyn Halle. Till next time, bye-bye.